Hi, welcome to everybody. So we are back again. This time it is Medica Cardio Talk 12. As we all know, that cardiac arrhythmia today can be completely cured and corrected by electrophysiology study and radiofrequency ablation. Conventionally, we do normal two-dimensional electrophysiology study and radiofrequency ablation by thermal energy, and we also do such procedures by 3D mapping. But again, the 3D mapping procedures are being done by thermal catheter ablation. Nowadays, we have a new technology which is called cryoablation, which essentially means that with deep ice or kind of at a very cold catheter, tip catheter, can actually remove the electrical short circuit of the heart and cure cardiac arrhythmia by this technology called cryoablation. We also come across with another technology called electroporation, which is again a very important and upcoming procedures to cure cardiac arrhythmias. This is being conventionally used for pre-excitation syndrome, WPW syndrome, or even atrial tachycardia, atrioventricular nodal reentrant tachycardia, as well as ventricular tachycardia. However, as we all know, that atrial fibrillation is progressively increasing in the community. People are living longer. It's a disease of the age and disease of cardiovascular substrate. This session is primarily focused on cryoablation in the context of treatment of atrial fibrillation, and also we will focus on electroporation in the treatment of cardiac arrhythmia. With me, my colleague Dr. Dilip Kumar is here. He has very special interest of cardiac arrhythmia as well as device therapy in heart failure and coronary and structural heart intervention. But today we are going to take some comments and hear his thoughts about the new concept of treatment of cardiac arrhythmia by cryoablation. Yes, Dilip, what do you think? What is this cryoablation? If you could tell our audience.
Yeah. First of all, I must admit, sir, it's a really exciting time for entire cardiac arrhythmia treatment. So we have in pipeline on in reality even cryo we have got, and we also look at another interesting therapy, what is called electroporation. So cryoablation, especially atrial fibrillation, which is a gigantic problem. 33 million people globally, they are affected with atrial fibrillation.
Yes, absolutely.
And we know that there is a 5 times increased chance of a stroke and multifold increased chance of heart failure. So it's a very, very big problem. And when we look at cryoablation and the ease with which we can do cryoablation of atrial fibrillation, it's what makes it more prominent. And
but if you could tell us in a very short or sort of that what exactly is the procedure for the viewers.
So cryoablation of atrial fibrillation is essentially same. It is we are isolating the pulmonary veins, and is not done by radiofrequency ablations, but it is done by the cold temperature, which is causing injury to the tissues. And we isolate this pulmonary vein, waka what we called, with this freezing temperature. So essentially, we nitrous oxide, the liquid nitrous oxide goes to delivered to the tissues through a console, and there is a very ultra thin pipe which is there,
right,
which goes into balloon. There is a specialized balloon.
Is it a very complex technology?
So this is what makes it different. So it looks very complicated, but it's not that complicated.
Exactly. So it is not as complicated as it looks like.
Yeah. So this is a special balloon which is there, cryo balloon, what is called Arctic Advance, and the newest one is Arctic Advance Pro, which has many limitations which were there earlier in the earlier generation cryo balloons that they have overcome with that. They have got a small nose, and they can detect the time to isolation earlier. So the fluoro time, the total procedure time, and the chances of injury is also less with this.
Excellent. It sounds really good. But sort of, what is the success rate, by the way? Let us say in atrial fibrillation.
Yeah, we have a comparison with radiofrequency ablation in fire and ice trial, and where they have shown that it is better than RFA in terms of recurrence of arrhythmias and survival and recurrent hospitalizations. This is better, although the significance was not reached, and it was basically non-inferiority trial. Other two trials like STOP AF and the STOP AF persistent, it has shown around 80% of the
that sounds really good.
Recurrence-free survival, recurrence-free time at 12 months. So it's quite interesting.
Excellent. So, which essentially means, although this cryoablation can also be done in patients with the WPW syndrome or atrial tachycardia, but for atrial fibrillation, as the success rate is relatively high and the recurrence rate is relatively low, so this could be a much preferred option as compared to radiofrequency ablation. But is there any side effect of?
Right, so side effects when we come and talk about cryo balloon, when specifically for atrial fibrillation. In AF we use a cryo balloon, and in other procedures there is a freezer catheter is there. So catheters are different.
Right.
So in atrial fibrillation, when we go with cryo balloon, the side effects are lesser than what we see in radiofrequency ablation.
Oh, right, okay. But some patients could be a little bit oversensitive or overreactive to such cryotherapy. What are
there are some?
How do we counsel them? What exactly we communicate?
Yes, very important, relevant point. There are some CNS adverse events are there, but thankfully they are temporary and they are.
And not even CNS, it's just kind of a headache, I believe.
Yes.
Headache and it goes off. So to you and to my viewers, let us say if some of our viewers who are actually electrophysiologists and have interest in management of cardiac arrhythmia by electrophysiology, if they wake up tomorrow morning and decide to sort of take a cryoablation, do you think they can do it?
Yes, sir. And this is recommended, and this is already in guidelines. We can use cryo, ablation of atrial fibrillation, and the chances of what we are very scared of. Entire AF ablation procedure is esophageal injury and phrenic nerve injury
is far less.
Far less. 1 in 25,000 esophageal injury. So it's very less, almost negligible. And if we pace the phrenic nerve and during the procedure, especially right-sided veins, during isolation, and this makes this procedure little vigilant, and we can know that this patient is going to have
exactly. So we can stop there. Exactly. We can clearly understand that a very challenging cardiac arrhythmia can be managed today by a more sort of effective treatment like cryoablation. So that is probably in short about cryoablation. So as we do more and more such procedures, I'm sure that we can present some more and more information. So now taking the cardiac arrhythmia management from cryoablation, let us talk maybe for a couple of minutes on electroporation. What is that?
So this is a new technology which is pipeline. But for last word regarding the cryo, the time duration of entire AF ablation procedure is when you start with, it's more or less what we have found in the studies, 120 minutes, and it can come down even lower, maybe lesser than 2 hours, 1.5 hour procedure. So this makes it more interesting.
So what do you reckon? Is it a very sort of cost effective? Let's say people may at the first instance think it is very expensive procedure, but on a long term basis, thinking in terms of prevention of more comorbidities, strokes and others, do you think it is cost effective?
It's cost effective, sir. And when we do conventional 3D ablation with RF and vis-a-vis cryo, the cost is not much different.
Excellent.
It's almost similar.
So electroporation.
This is very interesting and novel concept. It is like it's again a non-thermal way of ablating the tissue. It is by very short duration, microseconds, high amplitude pulse or electrical pulses which are delivered. The basic clincher is this is cardiomyocyte specific. They don't affect coronary arteries, they don't affect the esophageal tissues, they don't affect the phrenic nerve. So absolutely zero chances of esophageal injury, phrenic nerve and coronaries. So it is a cardiomyocyte specific ablation where a very microseconds of high amplitude pulses are given, electrical pulses, and which causes the holes in circular membrane and circular tubules. That's how they cause the permanent cardiac tissue death.
So as you have heard that it is exactly called electroporation, not electroporesis. Electrophoresis is different, but it is electroporation. That is the exact word which is being used for the management of cardiac arrhythmia. At what stage of evolution electroporation today?
So this is after the initial studies on animals. First in man studies are already done. Dr. Vivek Reddy presented this in HRS 2021, and not one, multiple companies are after this technology, and we feel that once it becomes viable and available for commercial use, it is going to be a game changer. But when and how it will happen, it's just a matter of time, a long time, and especially at this juncture, cryo looks very promising.
Excellent. So as you know, the technology is actually breaking through the management of many cardiovascular intervention procedure as well as the cardiac arrhythmia. So for cardiac arrhythmia management, as of today, cryoablation has come up with an excellent result, very promising success, and also very user-friendly and patient-friendly procedure. We also need to wait to get more data about electroporation. Till then, goodbye. But do see us on regular basis and watch the program called Medica Cardio. And see you again at Medica Cardio 13. Thank you very much.